Stand up for me. Right now, before the next sentence finishes. Move close to a wall or a sturdy chair. Don't touch it, just keep it within arm's reach in case. Now, lift one foot off the floor. Rest the top of that foot lightly against the calf of the leg you're standing on. Look straight ahead and count. 1, 2, 3. If you can hold that for a slow count of 10 seconds without grabbing the wall, without hopping, without setting your foot down, you just passed a test that most people over 60 have never heard of. If you couldn't, I don't want you to panic. I want you to keep watching, because what that wobble is telling you is far more interesting and far more fixable than you've been led to believe. Here's why I'm asking you to do this with me. In 2022, a team of researchers in Brazil published something that quietly unsettled a lot of doctors. They followed more than 1,700 adults, ages 51 to 75, for about 7 years. At the start, they asked each person to do exactly what you just did. Stand on one leg for 10 seconds. About 1 in 5 couldn't. And over the years that followed, the people who failed that 10-second test had roughly an 84% higher rate of dying from any cause than the people who passed. Read that again, 84%. Not because standing on one leg keeps you alive. A single skill doesn't do that. But because your ability to balance is a window, a clean, honest window into how well a whole network of systems inside you is still talking to each other. When that test gets hard, it's usually the first visible sign that the network is fraying. And a fraying balance network is what turns an ordinary step off a curb into a hip fracture. So let me take apart the belief that keeps people from acting on this. Most people think falling is about being clumsy or about weak legs. The story in your head says, I just need to be more careful, watch where I step, hold the railing. That story feels responsible. It is also incomplete, and the incompleteness is the dangerous part. Balance is not a leg problem. It's a brain and sensor problem. The Brazilian researchers pointed this out plainly. Unlike muscle strength and flexibility and heart fitness, which declines slowly and steadily, balance holds up pretty well until about your 6th decade, and then it starts dropping fast, faster than the rest of you. That's why a man who can still carry groceries up the stairs can suddenly find he can't stand on one foot to pull his sock on. The legs are fine. The control system isn't. If this is the kind of explanation you wish your last appointment had given you, send this to one person in your family who's over 60. That's honestly how this channel reaches the people who need it. Now let me show you what your wobble actually meant. And I want to do this slowly, because each possible reason points somewhere different. Picture standing still as a control tower. Your brain is the tower, and it's receiving 3 separate radar feeds at all times. The first feed comes from your eyes. The second comes from your inner ear, a set of fluid-filled tubes that sense which way your head is tilting. The third feed comes from thousands of tiny sensors buried in your feet, ankles, and joints, constantly reporting where your body is in space. The medical word for that third feed is proprioception, your body's sense of its own position without looking. Standing perfectly still is a myth. You are never still. You are falling a tiny amount in one direction, catching yourself, falling the other way, catching yourself again, 100 small corrections every second. Good balance isn't stillness. It's fast, invisible catching. When the test got hard for you, one of those 3 radar feeds was sending a weak signal, or the tower was reading it too slowly. Let's walk through them, from the most harmless reason to the one that means you call a doctor this week. The first and most common reason is simply this: you never practice it. Balance is a skill, and skills you don't use fade. If your day is sitting, standing, walking on flat floors, and sitting again, you may have gone years without ever asking one leg to hold your whole body. The circuit got rusty from disuse, not disease. For a lot of people, this is the entire answer. The good news sits right inside the bad news. A rusty skill comes back with practice, often within 2 or 3 weeks. We'll get to exactly how. The second reason lives in your ankles and feet. Around your ankle joint sit small stabilizer muscles whose only job is the constant micro-correcting I described. After about age 50, if they're not used, they weaken and the tendons stiffen. Your foot becomes a less sensitive platform. Think of trying to balance on a stack of firm books versus a soft pillow. The firmer the base reports back to your brain, the easier the catching. Weak ankles turn your firm base into a mushy one. This too is fixable, and the fix is gentle. The third reason is your eyes, and this one surprises people. Your vision carries a huge share of the balance load. That's why the test gets dramatically harder with your eyes closed. So, a new wobble can sometimes trace back to nothing more sinister than a cataract clouding things, an outdated glasses prescription, or the fact that you tried the test in dim light. If your balance is noticeably worse in the dark or since your vision changed, the next step isn't a neurologist, it's an eye exam. Vision changes are quiet. You adapt to them without noticing. The test notices for you. The fourth reason is the inner ear, that second radar feed. When the fluid system in your inner ear is disturbed, the world can spin, tilt, or lurch. This is true vertigo, and it has a specific feeling. The room moves even when you don't. One of the most common forms in older adults happens when tiny crystals inside the ear canals shift out of place. It sounds alarming. It is also often very treatable, sometimes corrected in a single visit with a simple repositioning maneuver done by a trained clinician. So if your failed test came with spinning, this is worth naming to a doctor because the fix can be quick. The fifth reason reaches deeper into that third radar feed, the position sensors in your feet. When the nerves carrying those signals get damaged, the feed goes dim. Your brain stops getting clear reports from the ground. The medical term is peripheral neuropathy nerve damage in the hands and feet, and one of its most common drivers is years of high blood sugar. Low levels of vitamin B12 can do it too. People describe numbness, tingling, a feeling of walking on cotton or on a floor they can't quite feel. If that describes you, the failed balance test isn't the problem, it's the smoke alarm. The thing to check is what's happening to those nerves, and that's a conversation with your doctor and a simple blood test, not a guess. And now, the level that changes everything, the finding that means you don't wait. Most balance loss comes on slowly, over months and years. So the warning sign is the opposite, balance that changes suddenly. If you lose your balance abruptly, and it comes alongside slurred speech, a drooping face, sudden weakness or numbness on one side of your body, a sudden severe headache, or sudden trouble seeing that as a possible stroke, and it is a call for emergency help immediately situation, not a wait and see one. Separately, if you feel faint or black out every time you stand up, that can point to a blood pressure problem, and some medications can cause it. Please don't stop or change any medication on your own, but do bring it to your doctor because that's a known and manageable cause. Sudden is the word that matters. Slow loss, we work on. Sudden loss, you act on. So look at what your 10-second test really was. It wasn't a verdict. It was a signal flare from one of those three radar feeds, and now you have a map of where to look. For most of you watching, the cause sits in the first two levels, disuse and weak ankles, and those are the most reversible things in this entire video. Here's the part you can start tonight, and I want to be clear about the order because order matters. First, before anything else, set up safety. Stand behind a kitchen counter or a heavy chair you can grip. Everything that follows happens within reach of that support. We are training the system that prevents falls. We don't do it in a way that risks one. The foundation move is the one you already tried, the single leg stand. Hold the counter lightly, lift one foot, find your balance, then let your fingers hover just off the surface. Aim for 10 seconds on each leg. When 10 becomes easy, build toward 30. Research on balance training in older adults suggests it's the steady accumulation that pays off. Programs that run for 3 months and longer tend to show the strongest reductions in falls. So this is a slow build, not a sprint. Second, train your ankles. Stand at the counter and rise onto your toes, slowly, then lower, 10 to 15 of those. This wakes up the small stabilizers we talked about. Third, train the walking version of balance because most real falls happen while moving, not standing still. Walk heel to toe in a straight line, like walking a tightrope, one foot directly in front of the other, counter or wall alongside you. 10 steps, turn, 10 back. Fourth, and only once the others feel solid, gently challenge the eyes feed. Do your single leg stand with your eyes closed for a few seconds, holding the support firmly. This forces your inner ear and your foot sensors to carry the load your vision usually carries. Go slow here. This one humbles people. Two large families of programs have the best track record for actually cutting falls in older adults. A strength and balance routine, often called the Otago program, and Tai Chi, with its slow, deliberate weight shifting. Across many trials, structured balance and strength exercise reduces the rate of falls by roughly 15% on average, and more in the people who stick with it. The theme is consistent: gentle, regular, weight-shifting movement, not heroic, regular. Let me set honest expectations, because false promises help no one. In the first week or two, you'll mostly notice the wobble itself. That's your brain relearning to read the feeds. Somewhere around week 3 to 4, many people find the 10-second hold gets genuinely easier. That's the neural circuit waking up. By 2 to 3 months, the gains in steadiness and confidence are usually clear. What practice can't fix on its own: nerve damage, an inner ear disorder, a vision problem needs its own treatment alongside the exercise. That's the difference between training a rusty skill and repairing a broken sensor. Want a second, gentler check to track your progress? Sit in a firm chair, arms crossed over your chest, and stand up and sit down 5 times as quickly as you safely can. If you can't do it without using your hands, or it feels very hard, that's another marker of the same leg and balance system, and it's another thing that improves with the protocol above. Retest yourself once a week. You'll feel the change before you can measure it. For reference, balance norms drop with each decade. Many people in their 60s can hold a single leg stand with eyes open for around 30 seconds, and in their 70s closer to 20. So if you're at 5 or 8 seconds right now, you're not broken. You're under-practiced, and the gap is yours to close. Before I let you go, tell me your decade in the comments. Are you in your 60s, 70s, 80s? I genuinely shape these videos around who's watching, and after 70, some of these mechanisms shift, so knowing where you are changes which sign I emphasize next time. So here's where we land. That 10-second test isn't a sentence, it's a flare. It tells you the control tower needs attention, and it tells you early while disuse and weak ankles are still the likely culprits, and while those are still the easy things to fix. The system that profits when you stay frail isn't going to hand you this as a free instruction, so I will stand up tonight, hold the counter, lift one foot, start the clock. 10 seconds is closer than you think.